If you have upcoming eyelid surgery, here are 5 things that I would do to prep for your surgery to make it as successful as possible. If you're new to my channel, I'm an eyelid surgeon. I've been in practice for over 10 years and I've done over 3,000 surgeries. So I just wanted to offer you some of my information for what I tell my patients prior to surgery. Number 1, make sure you stop any blood thinner. Simple things like fish oil, aspirin, Advil, Motrin, Aleve, all of those can interfere with the blood clotting process and they can make you more bruised after surgery. They can even make surgery take longer. So you want to stop those anywhere from 7 to 10 days beforehand. If you're on a more serious blood thinner like Eliquis or Xarelto or Coumadin or Plavix, those medications need to be stopped in coordination with your doctor. So talk to your surgeon about that. Number 2, make sure that you don't wear any makeup to your surgeries. Makeup, especially in powdered form or even more of like an oily hydrating form if you're wearing any kind of moisturizer, it can actually interfere with how easily we're able to mark the eyelids. We use a very, very fine tip marker to carefully mark out your eyelid crease, how much skin we're removing, and any other incisions we're making. When I do that, it's really hard if there is makeup already on there or if somebody's put a lot of moisturizer on, because it can make that area a little bit greasy or hard to wipe off, and your marks just won't be as accurate. So make sure you don't wear makeup to your surgery. That also goes for eyelashes. If you have false eyelashes, you want to take them off before surgery. Sounds obvious, but in reality, it does happen sometimes. They can fall off, they can get into the wound while we're working, and that can increase your risk of having an infection or some kind of an inflammatory reaction after surgery. Number 3, you don't want to eat on the day of surgery. So what they usually say is don't eat anything after midnight the night before your surgery. They might give you more specific instructions. If you're having surgery at a surgical facility, they'll call you a day or 2 ahead of time. The reason for that is because if you have food in your belly as you're going under anesthesia, if you happen to be one of those people who gets a little sick with surgery or a little bit nauseated, sometimes that can really come back to bite you and you can get food in your airway, and that's not a situation that you want. So it's really important to abide by that rule. Even though it sometimes sounds a little bit silly, it can be life-saving, and if you don't abide by it, it can get your surgery canceled, unfortunately. The same goes actually for if you're taking one of these newer medications like Ozempic or semaglutide or Mounjaro like tirzepatide that are for diabetes and also for weight loss. They can interfere with how quickly you digest food, so you'll want to stop those medications a week before surgery according to current guidelines. Number 4, make sure that you have a ride home after surgery. After surgery, you can't drive yourself because of sedation, especially if you're getting it done in the operating room under anesthesia. But also think about it, if you're having eyelid surgery, you're going to have swelling, bruising, you're going to have ointment in your eyes or on your eyelid. You can't be safely able to operate a vehicle. So make sure you have a ride. If you're coming from out of town, like a lot of our patients do, we do have a service that we can coordinate with to help you get a ride home. So that is something that we can help set up. Just need to make sure you let us know ahead of time. And number 5, go to the pharmacy and pick up a couple of things before surgery. It's so much easier to pick up things before surgery instead of on your way home from surgery having to pick up things and being black and blue or not feeling good potentially right after surgery. So first thing you want to pick up is antibiotic ointment. We prescribe something called erythromycin ointment. It's usually very reasonably priced and it's a prescription, and you put it on your incisions just a little bit twice a day for 14 days after surgery. The second thing you'll want to get is some Tylenol if you don't have any at home already. Tylenol is great for post-op pain control. In fact, I give Tylenol to 99% of my patients before surgery because there's been studies showing it really helps with pain after surgery. So even if you don't think Tylenol works, it actually really can help. And you don't want to take things like Aleve or aspirin or Motrin right after surgery. Get some sterile gauze, just in case you have a little bit of oozing anywhere around your eyes. I know that sounds gross, but sometimes that can help just to have something around, just to dab or hold on there, or even to put under some ice packs after surgery. Having that in the house can be helpful. You want to get some artificial tears. Your eyes will feel a little bit dry and sandy feeling, almost like a gritty sensation after most eyelid surgery. And having some of that at home on hand, just to drop in your eyes every couple hours, can really be helpful to making the eyes feel more comfortable and less dry dry. That usually lasts like 1 to 2 weeks after surgery. Grab a little tube or tub of Vaseline or Aquaphor or any petrolatum jelly. The reason for that is that can really help with scarring. Once you're past that first 2 weeks of antibiotic ointment, what I recommend to people is they keep a little tube or tub by their bedside, and right before you turn the lights off at night, just take a little bit, put it on any incisions you have, kind of layer it on there, and do a little 15 seconds or so of massage on any bumpy areas you feel. It can really help with healing to keep the wounds hydrated. If you'd like to learn more about eyelid surgery, feel free to check out more videos on our channel or subscribe. If you want more information about the services we offer, check out our website, eyelid.pro.com.